Any comments on MBBS versus BAMS?
MBBS versus BMS, one word is equivalent, and the one sentence is the way of the treatment is different, but the ultimate aim is healing to treat the sick people. That's it.
Hi.
Any comments on MBBS versus BAMS?
Of course, I have so many comments about MBBS versus BMS. MBBS is actually an emergency medicine or an acute treatment protocol, because if you are having a sudden heart attack or if you are having a sudden coronary diseases, something like that, BMS can't help at that situation. These emergency situations are always carried out by this MBBS, and even though we know after the integration of or after the coming of this Western medicine to India, there have been rapid increase in the decrease in the infant mortality rate and rapid increase in the health ratio of the people. So the emergency medicine should always be carried out by MBBS or this modern stream, whereas the long-term diseases like lifestyle disorders as well as arthritis or any other long-term diseases can be carried out by Ayurveda so easily. So I have seen patients with this long-term period of diseases or long-term exposure of some occupational diseases have been cured by Ayurveda, whereas acute diseases are treated by MBBS or modern science. So that is my comparison about MBBS and BAMS. So my aim or what I think is the integration of these both science should be linked together so that a better perception of health or better result of health can be given to the people in a short span of time. So integration is the best method to be given to the people of India, I think.
Any comments on MBBS versus BAMS?
If I have fever, I will not take paracetamol, I will take Kata. Hello.
Any comments on MBBS versus BAMS?
There is no particular comments as such, but we know that society prefers MBBS as their first preference. But मैं यही कहना चाहूँगी कि दोनों अच्छा है अपने अपने जगह पर. If you are smart enough, you can handle both. That's what.
Hi.
Any comments on MBBS versus BAMS?
Without MBBS, we can't move. Actually, for emergency service, emergency treatments, we need to move to MBBS. So without MBBS, I can say that we can survive without MBBS. For survival, we need to move towards the MBBS treatment or modern treatment.
Any comments on MBBS versus BAMS?
Both MBBS and BMS has their own strong point, and both of them are also going towards curing and treating people. MBBS is more dependent on technology and diagnosis and chemical medicines, whereas BMS are heading towards more natural remedies and going back to the root of the cause, which takes some time and patience, but also teaches us the beauty of doing things naturally. But both of them together can make a difference in curing people and bringing a more effective healthcare.
Hello.
Any comments on MBBS versus BAMS?
No comments. Both are like, it's not like that. That one MBBS is superior. We are also doing good. In future, BMS will do great in this field. That's what I want to say.
Hi.
Any comments on MBBS versus BAMS?
Okay. In Ayurveda, Swasthya Rakshanam, Aturasya Vikara Prashamanam. So we focus both healthy individual to maintain health of healthy individual and also cure it. So duita perspective swa hoy. Allopathic on mainly do curative hoy. Preventive to iman focus no kore, amara duita focus kore.
Hi.
Any comments on MBBS versus BAMS?
Actually MBBS versus ये क्वेश्चन ही गलत है कि मतलब MBBS वर्सेस BAMS क्यों है. MBBS has its own limitations, even Ayurveda has its own limitation. We can हम लोग मतलब इसको कंबाइन करके अगर हम पेशेंट को ट्रीट करते हैं तो फिर आई थिंक इट विल बी ऑफ इमेंस बेनिफिट टू द पेशेंट्स. आई थिंक कि वर्सेस नहीं होना चाहिए. इट्स लाइक आयुर्वेदा एंड MBBS. हम सब लोग सब कुछ ट्रीट नहीं कर सकता है, तो इसलिए both are good on their own.
Any comments on BAMS versus MBBS?
We believe on prevention.
Hello.
Any comments on MBBS versus BAMS?
No comments, because both MBBS and BMS, they are special on their own way. Commenting on both of them, on making differences on both of them is bad, because I think that MBBS, it has its own ground and BMS has its own ground. So we should stick up to their own ground, and like we should prosper into it. Hi.
Any comments on MBBS versus BAMS?
No, I would not like to comment on differentiating these two systems, the modern medicine and the Ayurveda medicine. I would not like to differentiate between them because they are not similar, and we should try to make them work together rather than finding out the disbalances between them.
Hi.
Any comments on MBBS versus BAMS?
MBBS versus BMS, a lot of people have misconception that BMS is like inferior to MBBS, but that's not true, because both fields are equally same. It's just the medicines are different. Diagnosis is same, patients also same, disease is also same, treatment also same. That's it.
Hi.
Any comments on MBBS versus BAMS?
MBBS वर्सेस BAMS नहीं बोल सकता है, सबका अलग अलग वो होता है, ट्रीटमेंट होता है। जो किसी रोग मतलब BMS में ठीक हो सकता है तो MBBS से वो मतलब मॉडर्न में नहीं हो सकता है। जो मॉडर्न में ठीक हो सकता है वो आयुर्वेद में ठीक नहीं हो सकता है। और होम्योपैथी में भी ऐसा बहुत इलाज है, यूनानी में भी बहुत ऐसा इलाज है, सिद्धा में भी बहुत ऐसा इलाज है, और इवन फिजियोथेरेपी से बहुत लोग ठीक होता है। तो भाषस नहीं बोलूँगा मैं, फिर भी मतलब ऐसा समाज में चल रहा है कि BMS वर्सेस MBBS, तो मैं ऐसा नहीं बोल सकता एक प्रैक्टिस ऊपर है एक प्रैक्टिस नीचे है।
Hi.
Any comments on MBBS versus BAMS?
Obviously, from my personal knowledge, it's not like that MBBS is like it's a best best branch, or like BMS is not like that. if हम लोग दोनों को साथ में लेकर चले तो हम लोग बहुत कुछ अचीव कर सकते हैं। BMS एंड MBBS दोनों, लाइक MBBS में हम लोग वो लोग क्या करते हैं, सिम्टोमेटिक रिलीफ देते हैं, एंड इन आयुर्वेदा हम लोग रूट कॉज ट्रीट करते हैं। तो दोनों सिस्टम अगर साथ में चले तो बहुत अच्छा रिजल्ट मिलेगा। इट्स नॉट लाइक दैट कि जो मतलब कोई मिसकंसेप्शंस जो भी है ऐसा नहीं है। हम लोग अगर साथ में काम करें तो बहुत अच्छा होगा रिजल्ट।
Hi.
Any comments on MBBS versus BAMS?
Actually, I don't want to compare. I don't want to compare the MBBS and BMS, but both science have their own identity, own individuality, and both are for human being only. So we should respect our own science, and we should not compare anything. But whatever MBBS can't treat, that one can be treated in our Ayurveda also, and something we can't treat by Ayurveda that is we used to treatable by MBBS people also. So I don't want to compare, but it's easy for us if we combinedly treat people. So thank you.
Hi.
Any comments on MBBS versus BAMS?
MBBS versus BMS, they both are different streams. I believe they both are like they both are doctors at the end, but BMS have the very in-depth knowledge of the disease and all, and the MBBS is much more scientific and all, but BMS is also good at its own place, I feel.
Thank you.
Thank you.